get your DNA rearranged. Yeah, I'm so glad you were able to schedule this well in advance. Sometimes some people aren't so forward thinking, and that leads them to, unfortunately, make some questionable decisions. So let's cover the basics. Why exactly are you thinking about getting your DNA rearranged? Okay, interesting. So you're thinking about getting your DNA rearranged, namely to elongate your crappy life and make yourself into perhaps someone that would be considered a Gigachad. Okay, very fair, very reasonable. So, with that in mind, we're going to turn you into a Gigachad. So, I can tell that your genes right now are producing lackluster results. If you don't mind the boldness, you can always install a bedside manner chip into my head. Would you like to? No? You like it when I'm direct? How sweet. So, we're going to now just map out your current facial structure. Your hair is thinning, your cheekbones are non-existent, you have a double jawline, that's not necessarily good either. Your nose is all pudgy, your lips are chapped, ew. Your eyes are kind of like buggish, no bueno. Your eyebrows are wispy. Your jawline itself, aside from being, double chinned, is also not the greatest. You have no jawline, so that's gonna need to be rearranged. Your shoulders are very weak. They slump down like Queen Victoria from like 300 years ago. And you have kind of like that skinny fat body that a lot of South Asian men tend to have. So this is currently how you look. As you can tell, this is no bueno. This would make any woman cry if she was forced to marry you, unless she has the content with everything package, but you and I both know that's a quite expensive subscription. So with that in mind, I'm just going to upgrade everything about you. We're going to give you the Gigachad chin. We're going to give you the Gigachad jawline, the Gigachad nose, the Gigachad mouth, the Gigachad eyebrows. We're going to give you the Gigachad hunter eyes, and there you go. Then we're going to give you the Gigachad hairstyle. There we go, there we go, there we go. Okay, and not to mention the Gigachad shoulders and the Gigachad muscles. So pec, nipple, nipple, abs, abs, muscle, muscle, collarbone, the Gigachad collarbone, the Gigachad Adam's apple, Gigachad cheekbones, and this will be the final result. Do you see how Gigachadded you're going to get? You're going to be Gigamaxed, and it's going to be fantastic. So, without further ado, I'm going to apply a little bit of anesthesia into the room and place some gloves onto my hands so that way we don't cross-contaminate biomaterial. Oh, that's not what I was looking for. This is what I was looking for. There you go. I'm gonna leave that to the side. Okay. Excellent. So, what inspired you to get your DNA rearranged? I see. Of course. Well, getting plastic surgery is one thing. This is certainly not plastic surgery, although it could be technically defined as genetic plastic surgery. What we're going to be doing is removing some of your genetic material so as to code it better. Excuse me. Once we code it better, we're going to be able to Once we coat it better, we're going to be able to inject it right back into your system. So that way when you potentially reproduce with a Gigastacy, you're able to create offspring that is of enviable quality. That is the difference between plastic surgery and plastic DNA surgery. Plastic surgery is deception, it's momentary changes, but in reality you don't look like that. Plastic DNA surgery fundamentally changes your genetic output. So, are you ready? Okay, good. I'm going to need to take a couple of samples from you. So, I'm going to just take, there we go, some little eyelashes and put them into this cup. So excuse me really quickly. I'm just going to take this one real quick and then put it right there. Take this one real quick. Then put it right there. Take that one real quick. Put that one right there. Put this one here. And then put that one there. Take this one, put that one there. Take this one, put that one there. Okay. Now I'm going to sanitize myself because I'm going to be taking some gooey materials from you. First things first, I'm going to be taking some of your mucus. I'm just going to ask you to flare out your nostrils as far as you can. Good. Okay. Now that you're flaring out your nostrils, keep flaring them for me. Okay. And I'm just going to remove it. Okay, good. And now I'm going to put it into this other canister. Okay, and now for your other nostril, I'm just going to remove some of this material. Okay, and just put it onto that. Okay, good. Now I'm going to take this little vial and I'm going to remove some of your earwax and I'm going to put it into this little vial. So I'm just going to go right in here and I'm going to just take some of this right out of your ear. And I'm just going to put that right in there. Okay, good. And now onto the other ear. I'm just going to take a little bit more from here. And then I'm just going to put that right there. Okay, excellent. Now, I'm going to ask for some breath droplets, but in order to receive your breath droplets, I'm going to need you to just breathe very deeply for me. It's going to fog up this mask and then it'll transport the saliva sample into this little container. So take a deep breath in and out. 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 Okay, excellent. And now I'm going to need a vial of your blood. So let me just get the band-aids all ready. Okay, there we go, there we go. Okay, perfect. So I'm just going to need a quick vial of your blood. I'm just going to go in real quick. Okay, good. I nearly forgot to sanitize the area again, but I did sanitize it before, and there we go. Let's just get 2 more vials. 2. Okay, good. 3. Okay, good, good. Okay, put some pressure on that site. Which band-aid would you like? We have orange, yellow, pink, blue, and green. What band-aid would you like? Green? Okay, so let me just apply the green one real quick. There we go. Beautiful. Okay. And now lastly, I'm going to collect a little bit of your plasma. This plasma is going to be so we can really get everything into our system. So I'm just going to ask you to lift up that arm for me. Yeah, just lift up that arm for me. Perfect. I'm going to go in real quick and I'm just going to give you, okay, yeah, just a quick little jab right there. Just going to take more of this plasma out, and even more, and even more. Okay, perfect. This should be about good. Insert that into the other container. There we go. Okay. After such intensive and invasive procedures, I'm just going to take your temperature so that way I can tell how hot you're feeling. You're feeling pretty good, or you look pretty good. How are you feeling? Good, good, excellent. Well, in that case, it looks like we have everything very taken care of. So your DNA will be ready in about 2 to 3 days. Let us know when you can come in. We'll inject it into your system, and overnight you will become Gigachaded. Okay, it's gonna be a rough night. Your entire system is going to kind of American Werewolf into a whole new body, but it's going to be so well worth it. So once again, just let us know when you're available and then we can schedule you into our system. Okay? Good. Well, in that case, until I see you, bye-bye.